Good evening, welcome to Left, Right and Centre. On the show tonight, the Prime Minister reaches out to Chief Ministers as the COVID situation soars. He says vaccinations have to be stepped up. He says that a vaccination utsav across the country may be a good idea. And on this particular day or days when this does take place, there needs to be an effort to ensure that there is no wastage of any dose of the vaccines. But he also says, and this was perhaps the bulk of what he did speak about to Chief Ministers, me bringing you those excerpts, he said step up testing massively. Don't worry about higher positive numbers. You can only treat cases and prevent the spread if you know who is unwell. Now we'll play out the main bits of what the Prime Minister has said, and this of course comes at a time when Maharashtra is reporting a serious shortage of the vaccine. On the show we'll be joined by two state health ministers, the Health Minister of Goa and Chhattisgarh, and later by Professor Devi Sridhar. She's the Professor and Chair of Global Public Health, Edinburgh, on how the UK dealt with its mutant strain crisis. We need to talk about this because any number of doctors have said there is likely a new strain out there which is more transmissible and which could, clinically it appears, be causing more infections. So we've got a lot on the table today, but first a quick look at what the Prime Minister has said.
और इसलिए मेरा आपका आग्रह है कि इस प्रेशर से बाहर निकल जाइए, टेस्टिंग को बल दीजिए, भले पॉजिटिव केस ज्यादा आते हैं आने दीजिए, लेकिन उसी का तो हम उपाय कर पाएंगे। और हमारी टारगेट 70%, 70% आरटी-पीसीआर टेस्ट करने का है। साथियों, जहां तक ट्रैकिंग का प्रश्न है, प्रशासनिक स्तर पर हर इन्फेक्शन के हर कॉन्टैक्ट को ट्रैक करना, टेस्ट करना और कंटेन करना, इनमें बहुत तेजी की जरूरत है। आज जो स्थिति है, आज जब हमारे पास सब संसाधन है, तो हमारा बल, और ये हमारे गवर्नेंस की कसौटी है, हमारा बल माइक्रो कंटेनमेंट जोन पर होना चाहिए। छोटे छोटे कंटेनमेंट जोन पे सबसे ज्यादा होना चाहिए। जहां पर रात्रि कर्फ्यू का प्रयोग हो रहा है, वहां मेरा आग्रह है कि उसके लिए शब्द प्रयोग हमेशा करें, कोरोना कर्फ्यू, ताकि कोरोना के प्रति एक सजगता बनी रहे। दुनिया ने भी ये रात्रि कर्फ्यू के प्रयोग को स्वीकार किया है, क्योंकि हर व्यक्ति को कर्फ्यू समय होता है तो याद आता है कि हाँ, मैं कोरोना काल में जी रहा हूं, और बाकी जीवन व्यवस्थाओं को कम से कम प्रभाव होता है। हाँ, अच्छा होगा कि हम कोरोना कर्फ्यू रात को 9 बजे शुरू करें या रात को 10 बजे शुरू करें और सुबह 5-6 बजे तक चलाएं, ताकि बाकी व्यवस्थाओं को प्रभाव ज्यादा न हो। दुनिया भर के समृद्ध से समृद्ध देश, जिसके पास सब सुविधाएं उपलब्ध है, उन्होंने भी वैक्सीनेशन के लिए जो क्राइटेरिया तय किए हैं, भारत उनसे अलग नहीं है। नए वैक्सीन डेवलपमेंट के लिए जितना भी कोशिश हो रही है, मैक्सिमम वैक्सीनेशन और मैन्युफैक्चरिंग कैपेसिटी है, उसके लिए भी काम हो रहा है, और वैक्सीन के डेवलपमेंट से लेकर स्टॉक और वेस्टेज जैसे जरूरी बिंदुओं पर भी चर्चा हुई है। ये बात सही है। आपको मालूम है कि भी इतनी वैक्सीन बन पाती है। अभी ऐसा तो नहीं है कि इतने बड़े बड़े फैक्ट्रियां कोई रातों रात लग जाती हैं। जो हमारे पास अवेलेबल है उसके हमें प्रायोरिटाइज करना पड़ेगा। किसी एक राज्य में सारा माल रख करके हमें परिणाम मिल जाएगा, ये सोच ठीक नहीं है। हमें पूरे देश को ख्याल करके ही उसको मैनेजमेंट करना पड़ेगा। कोविड मैनेजमेंट का एक बहुत बड़ा पार्ट वैक्सीन वेस्टेज ये रोकना भी है। क्या हम 11 अप्रैल से 14 अप्रैल पूरे अपने राज्य में टीका उत्सव मना सकते हैं? एक पूरा वातावरण क्रिएट कर सकते हैं टीका उत्सव का। एक विशेष अभियान चलाकर हम ज्यादा से ज्यादा एलिजिबल लोगों को वैक्सीनेट करें, जीरो वेस्टेज तय करें। हम 3-4 दिन जो है टीका उत्सव में जीरो वेस्टेज होगा। और मैं भारत सरकार को भी मैंने कहा हुआ है कि जितनी मात्रा में हम वैक्सीनेशन पहुंचा सकते हैं, पहुंचाने का प्रयास करें।
All right, so lots of important suggestions there by the Prime Minister. Will these be followed? Because now the situation across the country, these numbers surging like never before. Joining us, Vishwajit Rane, the Minister of Health in the government of Goa. I'm also joined by T.S. Singh Deo, the Health Minister of Chhattisgarh. Mr. Deo, let me come to you first. What is your vaccine availability in Chhattisgarh presently?
Vaccine availability.
Good evening, Vishnuji. Good evening to the Health Minister from Goa and all the viewers. We have been delivered 6,68,000 vaccines in the morning and 4 lakh vaccines in the evening. So that is what is available with us as a new stock. And whatever little was left from the earlier supplies, we'll continue with this and try to ensure that as much as we have, we vaccinate within that period. And we will expect the continuing batches to come as assured by the Government of India.
So you have no shortage, Mr. Deo, at the moment? Mr. Deo, you don't have a shortage at this stage?
A shortage is relative, Vishnuji. If our capacity is to vaccinate about 4 lakh and if we are being able to vaccinate 2 lakhs, so to that sense there is a relative shortage. But we have to see that the country has a particular production capacity today. And what can be supplied is only in proportion to that. So if you see it from the capacity of Chhattisgarh to vaccinate and the availability of the vaccine in the country, the production in the country, even today in the Prime Minister's conference, those figures were laid out that 24 to 25 lakh vaccines is the capacity today.
Right.
Which the government is planning to ramp up other vaccines which are coming on the platform.
All
as
right,
they
fair
get their
enough.
approvals.
Fair enough, Mr. Deo. 10,310 COVID cases in the last 24 hours. Chhattisgarh's numbers are not looking very good. I'll come back to you in a moment. I want to go across to Mr. Rane at the state. Sir, what is the situation in Goa presently as far as A, vaccines are concerned, and B, oxygen availability is concerned? Do you have any concerns in your state right now?
At the moment, Vishnu, we have sufficient stock of vaccines available in the state of Goa. And as far as oxygen supply is also concerned, we have no concern at the moment. But we find that the cases are slowly rising. Hence, we are taking sufficient precautions and measures. But the supply of vaccination to the state of Goa has been sufficient, and we are carrying out mass vaccination drives at the panchayat levels also in order to mobilize people to come forward.
Mr. Rane, in a situation like this, Goa, I mean, you can call it the tourism capital of India in so many senses. What exactly are you going to do about the fact that so many people come in? People in Goa are more vulnerable in that sense. Going forward, will there be curbs or further curbs on tourism?
Actually, Vishnu, we have yesterday discussed, the Chief Minister, myself, and with all the officers we have discussed. And as you know, that as you just mentioned, that Goa is a tourism state. And hence, as a result of which, there are a lot of tourists and people coming in from other states and neighboring states into Goa, where the COVID is on the rise. Yes, there needs to be certain precautions and measures to be taken. We are also emphasizing and using the deputy collectors and others to ensure strict implementation, firstly in place of, in usage of masks and fines in case of non-usage of masks, social distancing. As you know, we are trying our best to see that this is imposed, and in also gatherings and other things, we are trying to reduce the number so that we are able to keep a control on COVID-19 in the state of Goa. But definitely, as you mentioned, it's a challenge before us, being a tourism state and being surrounded by states where the COVID cases are on the rise. But yes, the Chief Minister is bringing in certain, we are bringing in certain SOPs in order to implement them very strictly. That has been the decision of the government. And also, it is a challenge in front of us in today's time, because being a tourism state, and as we find that, it's very difficult sometimes to impose and enforce certain measures. But I think time has come for us to impose and, take certain measures so that we are able to maintain and keep a control and strict vigilance on this rise of pandemic COVID-19. Today, Goa, we are seeing slowly the cases are on the rise, but yes, we will bring in certain measures, and we'll bring in stricter measures if required. We are actually, at the moment, we as a state have got sufficient capacity. We have put certain systems in place, so we are able to reach out to the people, identify them, and also we have also taken a decision to increase testing to a great extent, and we are actually successful in that area, which the Honorable Prime Minister mentioned today also. And if required, as you mentioned, we will bring in stringent measures in place.
All right. Mr. Deo, you're going into, Raipur is going into a 10-day lockdown. Tell us why that is absolutely imperative in the city of Raipur right now.
Raipur district registered a positivity of 57.07 yesterday, with more than 3,300 cases, positive cases. So that's very, very high. And for the last week and more, from the 1st of April, the graph has been continuously going up from 34, 35, 38, 40, 50, and now 57. So this is critical. It's a critical period where inaction, I think, would take up the spread of the infection even further. So I think the decision that the collector has taken is the correct one.
So, Mr. Deo, if that's a startling statistic, 57% in terms of positivity. I'm just trying to understand what are some of the steps that you have taken at this stage, to ensure that people mask up, social distancing, all of that, because people across our country just don't do that. What have you done? I mean, have fines gone up? What is the government doing?
First off, we are requesting them, making appeals, making IC representations, putting up jingles, putting up audio displays at traffic points, traffic lights, and of course, like you mentioned, we have hiked up the penalty for not wearing a mask from 200 rupees to 500 rupees. So that is a steepish hike, and a large number of people have had to face paying that penalty too. More than 2 crore rupees have been collected from fines.
Mr. Rane, is there any clinical evidence that your doctors tell you about of this being a different strain, one which is more transmissible, one which affects younger people more?
Vishnu, our experts and epidemiologists feel that this may be a different strain, and as a result of which, not just to rely on just the information without proper testing, we are also bringing in the genome sequencing machine and testing machine. We are installing it in our viral lab, so that we are very accurate in terms of what information we share and what information comes out. As of now, we are discussing, and everybody feels, because the infectivity rate is much higher than it was earlier. The jump also that is taking place in the state of Goa is much higher compared to last year at the same time when we analyze statistics. But definitely, in order to come to a very clear cut to say that and be having certain facts in front of us is very important before we make any statement, Vishnu, on the different type of strains. So as a result, what the government has done is we have enhanced the equipment in the viral lab. We have got a state-of-art lab which over a period of time we have enhanced with the latest equipment. This machine also will be installed shortly, so we'll be in a better position, because we need to do the testing of the strain.
What has happened?
There is too much of load in NIV, and we are not getting a sufficient response from NIV because we are dependent on NIV for this genome testing. So we are installing this machine in the state of Goa. Perhaps we may be one of the few states in the country having installing this machine, and then we'll be very accurate and we'll be in a better position to take appropriate measures and SOPs according to that. If it's a variant, a different type of variant, then accordingly we'll have to deal with it in a different way.
Mr. Deo, last question to you. Are your doctors telling you that this is likely, at least clinically, a variation, call it a mutant variation? Is it more transmissible, potentially more dangerous?
No actual scientific data on that, Vishnu, but undoubtedly mutations are taking place. More than 10,000 mutations, we are told, have already taken place or have been seen or recorded in the country itself. So there is little doubt that mutations are taking place. Whether this spike is due to a particular mutation is difficult to know. We were indicated by the government of India that a new mutation by the name of N440K,
yes.
Chhattisgarh has shown about 8 cases of this particular mutant. So that is about all, but we have also been told that there is no evidence that the vaccines available will not combat that. So no scientific data really available, Vishnu.
All right, I'd like to thank both of you very much for joining us. In your states. Both of you are fighting, this thing, and you're right in the front of that battle, and hopefully in your states and indeed across the country, it's a battle we need to win sooner than later. It's getting out of control, unfortunately, at this stage. Thank you both very much for being with us. Well, we're going to quickly move on now and change our focus to actually what a little bit more about what I was discussing, the entire issue of mutant strains. Remember, it was in the month of December that the United Kingdom detected these mutant strains, which were far more transmissible. In Kent, in the United Kingdom, ultimately tests were done, which indicated that 70% higher transmissibility occurred. And that UK mutant strain actually went around the world. It's known to have resulted in a great deal of infections, including, for example, in the state of Punjab, where more genome sequencing has taken place. Then there is the South Africa variant and the Brazil variant, and both of these are thought to be perhaps even more dangerous. And of course, there is that novel strain which has been found in India as well, with 2 mutations over there, but we don't really know very much about that or whether the present numbers are linked to that. One of the finest experts in the world to tell us about the evolution of this crisis of mutants is Professor Devi Sridhar, the University of Edinburgh. She joins us now. Thanks very much, Professor Sridhar, for being with us. How long did it take the United Kingdom to fight off the UK mutant strain?
Yeah, so this new strain called B117 emerged in September, and then by December in England, it was really taking off. And so England was late, but it went into a lockdown in December. By that point, hospitals were full in London, full in the south of England. And then here in Scotland, we could see that. So even before our cases rising and before having B117, we went into a lockdown to try to keep the numbers low. And actually, it is more transmissible, about 55% more transmissible. It is harder to suppress, but it is possible to suppress it. So through actually quite strict stay-at-home messages, asking people not to mix indoors, having shops close, having bars, hospitality, restaurants close, the numbers now are quite low. But now the worry is, as we open up again, are we going to see it transmitting more?
Professor Sridhar, are lockdowns the only way to fight a highly transmissible strain like the UK one?
It's a really hard one, because I think there are countries that early on managed to avoid long lockdowns by having a very good test, trace, isolate system. We still haven't managed in many Western countries to replicate the East Asian success with this, which seems down to having very rapid testing, very robust tracing of any contacts, but also having people isolate and monitoring that. That's where it's broken down here, because while people are happy to get tested, if you ask them to isolate and there's not very good payments, if you take time off work, people will choose not to isolate or not to get tested. And so this has been the main problem here. Without a functioning test, trace, isolate system to find cases, you're forced to treating everyone like they're infectious. So you're forced into a lockdown. But I think now the hope is with vaccines, as well as now they're bringing in mass testing as well, asymptomatic testing, as well as improving the benefits if you isolate, that hopefully we can find a way through this without having to be back in a lockdown this summer.
Professor Sridhar, how effective are existing vaccines on the UK strain?
So fortunately, the vaccines we have, Pfizer, Moderna, AstraZeneca, as well as Novavax, seem to be very effective against B117 or the Kent English variant. So we haven't seen a problem with what we call immune evasion, a virus evading our immune responses. The ones we are worried about are the South African variant, B1571, as well as the Brazil variant, P1, because these seem to be able to reinfect people who have already had what we call the wild type or original virus. So this is what we have to guard against. And it seems like the vaccine manufacturers can redo their vaccines to create boosters against these through slight tweaks. But then it becomes a cat and mouse game between how fast the virus can move and transmit in a new form and how fast we can change our vaccines to stay ahead of it.
So do vaccines need to be revised for greater efficacy against the South Africa and Brazil strain, the other two which are causing a lot of problems?
I think it's inevitable right now until we get a longer lasting protection. I know AstraZeneca is looking at, redoing it slightly for later 2021. The question now, though, that virologists are asking is, has this virus run out of ways that it can mutate? So are we seeing all its tricks now so we can get ahead of it? Or will there be more mutations to come in the future, which make it harder and harder to catch? But I'm actually really excited by the vaccine technology. We're seeing now mRNA vaccines being used against things like cancer, against HIV, against malaria, with really promising trials, as well as even this January, it was lost in the COVID news, but a universal flu vaccine, which actually could be used against numerous strains, which has always been a challenge for flu, getting the right strain. So I'm quite optimistic that science will provide really good solutions. And in 50 years, because COVID has accelerated the scientific progress, many of the things that we used to see as unachievable, such as an HIV vaccine or a malaria vaccine, might actually be possible.
Yeah. Has the pace at which the COVID virus mutated surprised you?
Well, I think it has surprised us, but it's not, if we think about it, it actually shouldn't be surprising because the virus replicates inside each new person's body or animal's body as it transmits into animals, and it changes. And every time it replicates, it can make slight errors, and these are mutations. And some of those mutations burn out, they have no selective advantage, but some have a selective advantage. So a selective advantage would be one that is more transmissible, that's easier, let's say has a longer stage where you're asymptomatic or pre-symptomatic, or if you have a higher viral load, or it has an advantage in terms of being able to reinfect people, which means that strain can jump where the one that couldn't is obviously not. So what you're seeing is natural selection, right? The virus wants to survive, and those strains that are more selectively chosen for will spread. So in a way, we are just seeing evolution, and evolution, unfortunately, in this case, is not on our side.
Is the UK variant more deadly than the original strain of the virus? We know it's more transmissible, but there are now studies also which say that in fact it is more potentially deadly. I mean, is that a view you share? And what's the best way to combat it?
I think right now the lesson from Brazil is that just hoping that this virus will go away if you do nothing and just let it be is a recipe for disaster. We've seen out of Brazil hospitals collapsing, relatives unable to get oxygen for those they love, people dying because they cannot get medical care. And while this is a virus that we can keep the mortality rate really low, even under 1%, people get very good medical care. If hospitals collapse, that mortality rate jumps up because people will die who otherwise would have survived had they gotten fluids or oxygen or a bed in a hospital. And so that's the worry with this kind of virus. Also because we are seeing this issue of reinfections, which means just because you have one wave, it doesn't mean it's over. You might have another wave coming through again when the virus slightly changes. So the lesson for the world is we need to suppress everywhere. We haven't seen mutations coming out of countries that have suppressed. We don't have a New Zealand variant or a Taiwan variant. We have variants emerging where we've had a lot of spread. Yeah. And also that we need to vaccinate everywhere quickly, because that is going to be ultimately our way out of this. The combination of mass vaccination as well as testing and trying to get that to all parts of the world. Because as long as the virus is circulating somewhere in the world, it can change. And if it changes in a way that it affects our vaccines or our immune response, then we're going to be forced to actually then have to tweak our response to it as well. So we just right now need to see a huge effort to produce vaccines where India is leading in this regard, and then getting them out to all parts of the world as quickly as possible.
All right, Professor Sridhar, great speaking to you as usual. So much information over there. India faces a real crisis, possibly with a variant of the original strain, and we really do need to vaccinate as fast as we can. Thank you very much for being with us.